Hi everyone, we're here at Conneaut Lake Veterinary Hospital and we're doing another program for my dog and me. And today we're going to work on issues involving the dog's eyes, ears, and teeth, correct? And with me is Dr. Don Consla, and tell us just a few things about yourself.
I'm one of the doctors here at Conneaut Lake Veterinary Hospital. I'm from the Meadville area. I went off to California for vet school, and I came back recently last May to start working here as an associate vet.
Sounds good. And who do we have here?
This is Martin.
This is the favorite one. This happens to be one of my dogs. And this is Martin, and he is 10 years old, and he is best known as being one of the best therapy dogs in the area. He's been doing a lot of therapy work for the last 9 years. But we've got some things we want to talk about with him, and we're going to talk about his eyes, correct? Because he's getting older, so that's a good idea to do that.
Yeah, for sure.
Okay, where we start? What are we starting with?
Well, we're going to start with some things that you can do at home to kind of take care of your dog's eyes, essentially. The most common question I get is probably about like discharge, like a little bit of like crusting around the eyes in the morning, just like people get, and pigment on the fur, like tear staining.
Okay.
And so for the the little bit of crusting that's there, a warm washcloth is fine, and just kind of wiping under the eyes. So you don't want to scratch the eye itself, but you can just kind of come under here and wipe in this area.
Okay, now he has a little bit of stuff hanging in his eyes.
Yeah.
You know, I had a poodle one time. And it was a black poodle, so you couldn't see too much of the stains, but you see it with the white dogs. My Shih Tzu has just stuff terrible down here.
Right.
Does it get worse as it gets older?
It typically stays about the same. Those breeds actually have a pigment in their tears.
Okay.
And so it's normal for them to have staining from the tears.
Is there anything you can do about that?
There's a lot of stuff out there that claims to make it better. My hesitation with those, like the Angel Eyes products and stuff like that, is a lot of them contain an antibiotic, and it just, I don't know, it strikes a chord with me to be using an antibiotic long term when it's not needed for something. So I usually just recommend, a warm washcloth. They make some like eye wipes that don't contain antibiotics, that just have like a gentle cleaner. And again, you can just kind of go below the eye there and just get some of that debris off. Now things you want to watch for is if there's excessive amounts of discharge and if there's any color change to it. So if it's kind of like a dark brown, that's fine. But if it starts to get really mucousy or like yellow, green, bloody, of course, all those types of things are more concerning.
It smells. The stuff that comes from the eyes. A lot of people will say to me, my dog needs a bath because he always smells it. And I say, you know what? You ought to smell his eyes. Because if you pull out one of those lumps in the corner of their eyes, and you smell it, it's like, oh my God, it's terrible. And sometimes I think that's the odor that people smell. That they think, oh, there's something wrong, my dog needs a bath. If your dog doesn't need a bath, his eyes are a mess. So it's really something. That's why I like black dogs. You don't see them scraping on the black dog. So can we do anything with him?
Yeah, so let's talk about some common eye diseases that we see. So I think probably the most common question I get asked is about cataracts. And dogs do get cataracts for a variety of reasons. Age, we can see congenital cataracts, secondary to other diseases like diabetes. But there's another process that happens in the eye which is much, much more common. And that's called nuclear sclerosis, which means scarring of the center portion of the lens. Okay. The lens is kind of the structure in the middle of the eye that takes light and focuses it on the back of the eye, and then that signal gets sent to the brain and is interpreted as an image.
Can you sit?
So, as the lens ages, the cells of it die off, just like skin cells die off, except when a skin cell dies, it can just fall off into the environment. The cells of the lens can't just start falling off into the middle of the eye, because then there'd be stuff floating everywhere and it would mess with vision. So instead they kind of build up as they die in layers, kind of like the layers of an onion. And so eventually, when enough of those layers of dead cells build up, it causes the lens to look a little cloudy. And so that's what most people see when they're concerned about cataracts. The light hits the eye just right, and it's almost like there's like a pearl in the eye, or kind of a grayish hue, not in the front, but more in the middle of the eye. And it looks, especially if it gets advanced, almost like a cataract. The difference is with nuclear sclerosis, if I use my light and shine it in the eye of the dog, I can still see the back of the eye with the nuclear sclerosis.
Okay.
If there's a cataract there, a cataract is more solid and like mineral-like, and so the light's not going to go through, so I can't see the back of the eye.
Can you see anything other than, you said that was on the lens, right?
Mm-hmm.
Is there anything that you can see in the eye with that in addition to the lens?
Oh yeah, so we can see pretty much everything. So when you bring your dog in, the first thing we'll do is just use the light source. So you can see on my hand that it's a pretty bright light there. And so I'll just shine that in. And like right away I can see that he has some of that nuclear sclerosis, which is an age-related change. I don't think I mentioned that. It's not really a disease, it's not a problem, it's just something that happens with aging.
Can you take it off, or should you, does it ever,
No,
just stays there?
It just stays there.
Does that hurt his vision?
There's been some studies that have said that maybe it affects like close-up vision. So I've had a couple of owners report that, oh, when she dives for her ball, she seems to miss it on the first try.
Okay.
So I don't know if it's related to that, but as a whole, it doesn't result in blindness. It doesn't cause any major visual deficits.
So you can live with
like
that. Do you understand that? Okay, he said he can live with that. He says that's good. His eyes are so pretty, we've got to make sure we take good
They
care
are.
of them here.
So we shine the light in. You can see that pearl kind of right away, and it's on both sides.
Can you get that? Okay.
And then, when we shine the light in there, we're looking at certain reflexes as well. So the pupil should constrict when the light shines in there. If it's a really bright light, the eye will actually kind of retract back a little bit. Almost like when you turn the lights on in the middle of the night and you're like, it stuns you a little bit.
Yes.
That's called the dazzle reflex. It's got
Okay.
a fun little name. And so we're looking at all of that. We're looking, are there any lesions elsewhere, not just in the lens, but on the cornea, the clear part of the eye?
Do you see a lot of that stuff?
We do, yeah. And so one of the more common things we see would be a corneal ulcer, and that's where there's a little defect in the clear part of the eye, the cornea, which is on the surface. It'd be the equivalent of like a cut or a scrape.
Is that something that's taken care of easily?
Generally. So there's a lot of different causes to it. One of the more common causes is trauma. A dog's out hunting with its owner, it runs through a briar patch and gets a scratch on the eye. Dog gets a little too curious, tries to play with the cat. Cat doesn't like it, gets scratched in the eye. So that's pretty common cause of it, trauma. We can see it secondary to some like infections. We see it more in cats, but like upper respiratory disease can cause some lesions there.
Is that treated topically, just with ointment or something, or do we have to do surgery?
It depends on what the cause is.
Okay.
And then another common cause would be like in the small kind of squished-faced breeds, their eyes are just kind of out there more, they can dry out. And then we can see it secondary to a lot of other disease processes. So we typically like to find out what the cause is of it first.
And we didn't see that in his eyes?
No.
His were okay.
No, his were okay.
That's good news.
And we'll talk about some of those tests in a little bit after we, finish talking about some of these diseases. But there's some tests that we do to kind of localize, what's going on. The other thing we can see with that instrument I had, the ophthalmoscope, is the back of the eye, which would be the retina. And there's the optic disc back there, which is all the nerves focused at that point. That should have a certain appearance. There's blood vessels in that area, so if there is, say, high blood pressure, we might see some burst blood vessels back there. If the dog got into rat poison, we may see bleeding in the back of the eye before we see it elsewhere. So the eyes really tell us a lot about what's going on, not just with the eyes themselves, but the whole entire body.
Can you see more in an eye of a dog that has that big eye like my Shih Tzu does, or doesn't it really matter?
It doesn't really matter.
Okay.
We can usually get a pretty good look, regardless of the size of the eye. Yeah.
Okay.
We check reflexes as well. So if I poke here, he blinks, which is good. That means he's both sensing that I'm poking by his eye, and his brain is sending the signal to blink.
Okay.
So that tells us about a lot of nerve function there. If I make a threatening motion, like something's coming at him, with my hand here, see he blinks? That's called a menace response.
Okay.
That tells us a lot, about vision and again about some of those reflexes. And there's a lot of other tests we can do that we'll talk about. Other common diseases would be dry eye, or the fancy name for it is keratoconjunctivitis sicca. You can see why we just call it dry eye.
I think dry eye is a lot easier.
And that is where the immune system gets a little confused, and it actually attacks the tear glands. And so tears keep the eyes moist and make sure no debris gets stuck to the surface. And if there's no tears, the eyes kind of dry out. And so with those dogs, we tend to see a lot of like mucoid discharge because the mucus glands are trying to compensate for the lack of tears. We may see ulcers because the surface is so dry, it's almost like abrasive. And that's easily treated as well with some topical medications to basically quiet down the immune system just at the level of the eye.
Just like a person that has dry eyes.
Right.
Okay, gotcha.
One more common disease that we see would be glaucoma. Just like in people, it's high pressure within the eye. And we can have, a lot of different causes of that. Some breeds are predisposed to it, like things just didn't form right in their eye, and so the fluid doesn't drain well, so it backs up.
Can you test that?
And we can test that as well. And I'll show you how we do that.
Okay.
And then there's secondary causes of glaucoma, inflammation in the eye, masses, that type of thing. But those are some of the common things we see. For when you're watching at home, I already mentioned watching for discharge. Any type of redness in the eye, whether it's in the clear part of the eye that you can see, or up here on the whites of his eyes. If the white ever turns pink or red, that's a concern. Any redness anywhere is always a concern with the eyes. If he's blinking, like squinting his eyes, that would be a sign of something.
Or one that's closed.
Or one that's
just
just
open all the way.
Right, one that's just completely closed all the time. And then just looking at like the pupils. So if you look at him and his pupils are just huge all the time, that usually tells us something about blindness being there.
He hasn't been drinking, in other words. Probably not. None of that stuff. What?
Okay, so let me show you some of the things that we can do, when you bring your dog in for some eye troubles.
Well, what should is there anything, just any preliminary things I can do myself on a regular basis with the dog's eyes, or is that
aside from keeping them clean, that's kind of the biggest thing.
Okay.
All the tests, test specific things, and really, your vet needs to be involved to do that. So there's kind of 3 tests that we always recommend if there's an issue with the eye and we're not really sure what's going on. A tear test to measure tear production.
Okay.
Stain to look for defects in the cornea, like ulcers, and then measuring the pressure within the eye.
And we can do those.
And we can do those.
Get ready, big boy.
I'm not going to do them all to him because I don't want to torture him, but I'll show you, what the tests look like and what we're looking at.
I had a collie one time, and he had those put in his eyes all the time just to keep on checking too. Because collies have collie eyes, or that small eye, and they've got some issues with their eyes.
They have all sorts of stuff.
Right.
So this is called a Schirmer tear test. And it's basically a little strip of paper, and it has numbers on it. And we put this in the eyelid.
Do we want to do one to him?
We can do one.
I don't care. Here it comes, Mark. Get ready. I've seen this done, and I always thought, oh, I can't believe that they're doing this. But as I said, they did it all the time with my collie.
Yeah. So there's a little wedge, and we're going to kind of put that down in the eyelid. And the thought is that if there's something in the eye, the body should start making tears in response to that.
Okay.
Okay?
Do I need to hold his head?
Just
or can you get him?
If you hold his head for me,
I think he'll let us do whatever we want. He doesn't really care about too much.
Okay. So it looks kind of weird, but it's not poking his eye. It's just kind of down below the eyelid. And we would hold that there for a minute. Okay. And then measure, where it goes to. Is
there usually the same condition in both eyes? Or are they sometimes
typically, if there's dry eye, it's in both eyes. So I'm going to take it out because he's already at 15, which is kind of the normal.
Okay, so he got there real fast.
He got there real fast.
Probably
so
15
he doesn't have any dry eye.
Okay.
But you can see, that little blue dye has moved up to the 15 mark there.
So that's an easy test to do.
And so that's an easy test to do.
And what does this show? This shows dry eye.
This shows tear production.
Okay.
So let's say a dog did have dry eye. It might stop at like 2.
Okay.
Sometimes we'll see, in the early stages, maybe it goes up to 10, but that's still not normal. So it tells us a lot.
Okay.
We would do that in both eyes, of course, to measure production there. And then, like you said, if we do find dry eye, we recommend, retesting, initially a few, every like week to month or so till we get things dialed in with medications, and then like once or twice a year at the wellness exam.
I think one of the easiest things I've ever done to a dog is to put drops in their eyes.
Yeah.
I find that simple,
Yeah.
as opposed to doing some other things as far as the mouth, and then I go, oh, I can't handle that. But the eyes are not that tough to deal with.
Right.
I don't think they are.
So the next, so we always do the Schirmer tear test first.
Okay.
We do these in a specific order just because if we do them in a different order, we can get false results. So we
Okay.
always go in this order. So next we would do the stain of the eye, and this is called fluorescein stain.
Do we want to stain them? We don't care.
Well, I don't know if you'll be able to see the glow on it, but it's a little strip, and I just put it in a syringe with some saline so you can see. Even just in regular light, it almost kind of glows a little bit. It's got this like fluorescent color to it.
And you put that in each eye?
And so we would put a drop in each eye, and you can see there how it kind of, it's this like neon highlighter yellow. We would put a drop in each eye, and then we would flush it out just with eye flush.
And are you doing a test after you put the drop in, or after you?
The drop is kind of the start of the test, and then we look at the eye with a special blue light. It's called a cobalt blue light. And what will happen is if there's any defects in the cornea, so like any cuts, scrapes, indentations, any ulcers, that stain will stick to the cells below the surface, and so it'll stay there, and then when we use the special light, that spot will glow neon green, essentially.
Good. I've seen that done too.
Yeah. The other kind of perk of that test is that if all the tear ducts are patent or open, it will actually drain out the nose. Okay. So a lot of times we'll do the test, and we bring the dog back in the room, and they have a little green drop coming out of their nose, and that is also a test in itself, and it tells us that all the tear ducts are patent, and that things are moving through like they should, and it's draining out. So a lot of times in some of the smaller breeds that we worry about tear duct malformations, we can use that not so much to look for ulcers, but we'll put it in, wait a little bit longer, and then look up the nose instead of directly at the eye to see if that stain is coming out like it should.
Okay.
And so then the final test is to measure the intraocular pressures
For glaucoma.
for glaucoma, right?
Okay.
And so we have this special little machine here. It's a tonopen, or tonometry is the measuring of the pressures. And
that's the same one they do to us in the we go to the
it's
eye
exactly
doctor.
the same thing. And so for this we put a numbing drop in the dog's eye because it would be mildly uncomfortable to be poked in the eye.
Yes.
And so we numb the eye up, and then we take the pressures and we just gently push against the cornea, and it gives us a number. We take 3 readings, and we average those together.
Now, all the tests that you've done can be done in most veterinary hospitals.
Yeah.
Okay.
I think these are pretty, standard things to do, and they're all very quick. And the other thing is they're all, very benign. None of them are really invasive. There's no like poking or sticking or anything like that. They're all very quick. And they really don't cause any discomfort to the patient either, which is nice. So we can get a lot of information very quickly without a lot of stress.
So that's it for the eyes.
So that's kind of the gist of the eyes. Treatment usually consists of, like drops or ointments depending on what's going on. I personally prefer drops. I just think they're easier to get in, and it helps with compliance a little bit. Some people prefer ointments for the same reason. They find it's easier to use an ointment. And so it's some personal preference there.
And if we do find things that are a little bit more advanced, then I know that my dogs have been patients down at the clinic down on Camp Horn Road.
Yeah. And so if we find like a mass in the eye, or just certain things that may need surgery, eye surgery that we don't do here. You need some special instrumentation for stuff like that. We can refer down to the ophthalmologist at Pittsburgh Veterinary Specialty and Emergency Center
On Camp Horn Road, right off 279.
Exactly, and they do a wonderful job there. I spent some time with them, and they're all very nice.
Hey, what's the other thing, though, that I know Dr. Bagley does some clinics up here, not to just check the overall health of an eye, but there are certain breeds.
Yeah.
What is that? That's the surf test, maybe? Or
yeah.
I think that's...
CERT test.
Yeah, is that what it is?
Yeah. And does he do that with up at Canberra.
I think he has it at Canberra, and you just can't walk in there. You've got to make arrangements for him to see you. But that's for dogs that could possibly have some type of a genetic situation that he checks to see the puppies and stuff like that. And he's very, very good. I've known him a long time.
Yeah, he's a good guy. One other thing to watch for I forgot to mention would be changes with how your dog's walking around at night. So a lot of changes in the back of the eye, the retina, can cause like night blindness, and if they're slowly progressive, you might notice your dog's fine during the day, but at nighttime he seems to be, bumping into the bed, the couch, that type of thing. So that's another thing to watch for.
I brought one of my dogs down last week to see Dr. Wade, and I said he's really being funny about his eyes. I think there's something going on with his eyes. I said when he goes from one part of my house to the other, he scoots because he looks like he can't tell where the chair is or a bench is or something like that. No, there's nothing wrong with his eyes at all. He must have fallen on my floor in my kitchen, and now he's got himself so worked up that he's kind of nervous about going certain places. She did all the tests. There was nothing. And we decided it's just him. He has gotten himself upset, and that's what he's doing because he's seeing perfectly fine, especially anything on the property. So she did some preliminary things like that too. And what she needed from me, which is so important, which you just mentioned, is you as a pet owner, and we talk so much about this as far as them being responsible, watch what your dog's doing and keep track of it. And because whenever I talked to her, I said, well, here he does this, and he does this, and this, and this, and I must have had a list of 5 things. And it helped her diagnose what we thought the issue was.
And another thing to bring up is dogs do remarkably well without vision. Because it's not their primary sense. People often think like, oh my gosh, my dog's blind, like how is he going to survive? But vision is like our primary sense, To a dog, it's more hearing and smell. And so I've had dogs come in and the owner's just like, she seems to be, like missing her ball when I throw it. Otherwise, totally normal navigating the house. And the dog was blind, And so it can be very subtle, some of the changes that you notice at home, because they adapt so well.
Except for don't change the furniture, because once they know where the furniture is, that's big. Hey, I know what I wanted to ask you. What about certain breeds that are prone to blindness? I'm thinking Dalmatians, I'm thinking some white dogs. What's the story with a lot of... Oh, that's deaf, isn't it? That's not blind.
Deafness,
okay, all right. I was thinking there's something with certain breeds too, but nothing else as far as the eyes are concerned.
There are some breeds that are predisposed to like some retinal degeneration and things like that, but there's a lot of breed variation, and there's other genetic diseases like basset hounds and glaucoma, stuff like that.
Okay, we're all set, right? Okay, that's a little bit of a presentation on the eyes, and we're going to talk about the ears next. Okay, we're back now. We've already done our presentation on the dog's eyes, and now we've got Gracie. And Gracie's a black lab. I think Gracie's a little over 1.5 years, almost 2 years of age. I think she's about 2. She might be a little bit more than that. And we're going to do the ears with Gracie. And you can see, this is so typical compared to Martin, who doesn't care what we do. Gracie's a little nervous right now, so we're gonna have to work with her a little bit.
So ears are a very common reason for dogs coming in. The most common issue we see is what's called otitis externa, which is inflammation and infection of the outer portion of the ear. This little model here kind of shows the anatomy of the ear. And you can see that here's the part that we see, and then this is kind of in the dog's head here, basically. And so we have a vertical canal here and a horizontal canal here, and then this little structure here is the eardrum. Okay, so there's a lot going on there. Common, the otitis externa is inflammation of kind of all of this area here. And then there's the middle ear and the inner ear, which can cause their own set of issues, but we don't see that quite as commonly.
Okay, are conditions different in ears for down ears and up ears?
We used to say yes, but I think the answer now is no. There's been a lot of studies that have been done looking at that. Because we used to say, oh, the ears are down, so not as much air gets in and stuff like that.
Not an issue anymore.
But it seems to be more the breed, not the positioning of the ears.
Gotcha.
So the one study that comes to mind, like Cocker Spaniels and German Shepherds had the most ear trouble, and German Shepherds have the most pointy, straight up ears as all of them. So it's more of a breed issue, you know, some of the genetics that tie into the microenvironment of the ear and that type of thing versus the position of the ear. Yeah.
Okay, what should we do first with Gracie?
So
She's calmed me down a little bit here,
yeah.
so we're making a little bit of progress.
Things you can do at home. The biggest thing would be just regular cleanings, like once, twice a month. Things not to use would be like hydrogen peroxide, things like that. That's very drying to the ear and very irritating and can sometimes precipitate more problems or make a problem that's there worse. So I always recommend some sort of veterinary ear cleaner. This is the one that we carry here. And it's an acidifying agent, which means that it's going to just change the environment of the ear a little bit so it doesn't favor the growth of yeast and bacteria so much. And then, you know, it's got some aloe and things like that in it that are nice and soothing.
When a dog, because Gracie, this is a good choice for the ears, is a black lab and probably likes to swim, can we just assume that they're going to automatically have clean ears because they swim, or is that another issue we need to deal with?
It's oftentimes the opposite because they get water in there and it just kind of sits in there. So one thing you can do is if your dog swims a lot, when they get done swimming, just do a quick cleaning with this and it'll kind of help dry things out a little bit.
Okay.
And then I just use like a gauze sponge or a cotton ball is also appropriate. And so
how about a Q-tip? Too small.
I would not use a Q-tip. The chances of you hitting their eardrum are still pretty slim because of that L-shaped canal that we looked at. It's really hard to get to the actual eardrum, but like the cardboard kind of Q-tips versus like the wooden ones can kind of bend around that corner, so you worry about it there. And then like the wooden handled ones can break off and cause some issues that way too.
Don't want that to happen.
No.
Okay.
So for cleaning, use a veterinary ear cleaner. And if you'll just hold her head up a little bit. The trick is to kind of straighten out that L as best we can.
I got her okay?
Yep. And so I just hold the base of the ear like this and kind of pull up a little bit. And then we would...
She's not going to like that.
I'm not actually going to do it, Gracie.
No, Gracie, we're not.
And then you fill the ear canal up until your solution starts to come out. So you want the whole entire L shape to be full of the ear cleaning solution.
And then you kind of milk that?
Right, and then you just hold at the base of the ear, and there's all these this cartilage down in here, and you can feel it. You know, if you feel up here, it's like squishy. If you feel here, it's squishy. If you feel at the base of the ear like this, it's a little firmer, kind of like your nose or the tops of your ears. And you want to squeeze that area and just kind of massage it.
And then step back because she's going to shake her head, isn't she?
Right. And so you often hear like a sloshing sound. That you know you're squeezing it right if you hear that sloshing sound. And then what you'll do is you'll stand back. Unfortunately, you can't stand back. She would shake her head, and that's going to work. All the debris that you just worked loose with that massaging motion is going to come out. And then all you do is you take your cotton ball or your gauze square, and you'll just come in and just wipe it out.
Okay.
And it's already been worked out because of the cleaner and that massaging motion that you did. Once, twice a month. Unless they have some underlying ear issues, you should be good to go with that.
A lot of dogs that go to the groomer. A lot of the groomers do that.
They'll do that for you.
Also pull out the hair.
Yeah, and so that's
Is that just certain breeds that they do that on?
Yeah, some of the smaller breeds. I think about like miniature poodles comes to mind. Some Shih Tzus.
Yeah.
They just have a lot of hair in their ears. And that's not necessarily a bad thing, but it can trap debris and stuff in there, and so that can lead to some ear troubles.
And sometimes they pull that hair out.
And so sometimes they'll pluck it out. And most of the times it's just in kind of the external ear canal, and so it's not like they're going way down in there and yanking hair out. They just kind of do the external to kind of help get some of that out of there.
What about breeds that... if a dog is allergic to different things, I'm always thinking of the Goldens, doesn't it sometimes show up as ear infections a lot?
So that's one of the most common things that we see with ear. So we talked about the otitis externa, the inflammation infection of the outer ear. Whenever we see that, the question becomes, is that an isolated incident? You know, did they go swimming, got water in the ear, and that's what caused it? Was there some hair in there that just happened to trap some debris in? Or is there something going on underlying that's causing it? So if it's the first time they have an ear infection, we get a swab so we can look at it under the microscope, see what's growing in there, pick the appropriate ointment, and get it cleared up that way. If it keeps coming back, then we have to ask the question, okay, what is causing these to reoccur? Because, you know, if it's a dog that doesn't go swimming all the time, you know, goes out in the backyard to play fetch, and that's kind of the extent of its outdoorsiness. You know, they're not getting a ton of dirt caked in the ears. There's not a lot of water in there, so there has to be something else going on. So the most common thing is allergies, environmental allergies, which we call atopy. And in a lot of dogs, that does manifest in the ears and, you know, like the feet. It can be certainly throughout the entire skin coat. Environmental allergies in people cause, you know, like sneezing, watery eyes, that type of thing. In dogs, it causes skin issues.
As an owner, some of the things that I sometimes think about, again, we were talking a few moments ago about the eyes also, but sometimes if you lift up that ear and take a little whiff, you can smell that smell, and that's always indication, and also it gets extremely red in there.
Yeah.
Or my dogs sometimes carry their head to the side because something's bothering
it's irritating.
them. Yes.
Maybe shaking their head, pawing at their ear. All those things indicate some sort of discomfort.
And that's what the owner has to watch for.
Right.
Anything like that.
Yep, and like you said, the discharge and the redness are another big indicator.
Okay.
Now I mentioned briefly middle and inner ear diseases. Instead of, you know, like the redness discomfort that we see with outer ear diseases, with those we tend to see more like neurological problems, like a loss in balance, a head tilt, stuff like that.
Yeah. You're doing better, Gracie.
Yeah.
The tail's starting to wag. That's a good sign. It's not between her legs back here. Getting all upset.
So other ear conditions, you know, could be like ear masses, whether it's in the ear canal, on the outside of the canal. But by far the most common thing we see is that inflammation.
Do you see a lot of major issues with the ears?
As far as...
Well, let's say that 10 different dogs came in with ear issues. How many would be something that has to be taken care of, would be a mass or something?
Yeah, 9 out of 10 would be just that inflammation and
stuff.
infection.
Yeah.
So it's most commonly that.
So we don't want people to think as soon as there's something going on, my dog has a mass.
Right,
It's probably just something as far as their hygiene or you taking care of them or getting them.
Or they have some underlying, you know, problems. And that tends to be the more like costly long-term type of thing if it does keep coming back, and we have to try and figure out what it is. Is it allergies? Is it due to an endocrine disease like low thyroid or Cushing's disease? All of those types of things.
Okay.
Could be a food allergy, you know, so we have to start, you know, going through that stuff and choosing tests that will give us the most information and help us decide what's going on.
What do you think, Gracie,
So things that we do here when your dog comes in for an ear infection, like I said, we get that swab so we can find out what's going on, and that's very important because we could just choose, you know, any old ear medication, but if it's not going to kill the yeast or the bacteria there, we're going to treat for 10, 14 days, and it's not going to do anything.
Okay.
So that's the importance of that swab. And we take the swab, we put it on a slide, and we use a special stain, and we look at it under the microscope. So we can say, oh, there's yeast here, there's this type of bacteria, or this type of bacteria. So it really gives us a lot of information.
What about ear mites?
Ear mites.
That's something else they get too. Is that pretty specific?
That's more cats.
Oh, is that cats? Okay.
We don't usually see ear mites in dogs.
Okay.
Yeah.
Really, I didn't know that.
Yeah, but we use the swab for that as well.
Okay.
And you'll see them swimming around in there.
Oh, one special.
Yeah.
Anxious to not see that.
So after we get that swab, then we do a really thorough ear cleaning. Because if we're going to be putting a medication in there, we want it to be able to get to all of the tissues of the ear. And if there's a bunch of wax and debris in there, it's not going to get there.
Do you sometimes have to put the dog or anesthetize the dog to be able to really clean it?
Yeah, I would say, you know, 90% of the time we can do it with them awake. But if they're very painful or if the dog is aggressive, sometimes we have to put them under anesthesia.
So that sometimes happens.
Because, like I said, it's very important to have that thorough ear cleaning so that our meds can do the job that we need them to do. And then, you know, if the dog's like scratching at their ear a lot, we might recommend an e-collar, sometimes pain medication if the inflammation is very severe. And then another thing that we have to offer that really helps with that like red hot inflammation is the companion laser therapy. Just a single treatment to really quiet down the inflammation that's there and kind of speed up the healing.
Do the laser just on the outside?
Yep.
Just on the outside?
Right, and so we would like lift up here and we would just kind of do around in this area. And it's gonna, you know, anything up here obviously it gets because it's on the surface.
Sure.
And then the ear canal is dropping down like this and then kind of going in, and so it's penetrating those tissues there.
Gotcha.
And I've seen, you know, some pretty remarkable results in just some really hot ears that it helps quiet down some of that inflammation.
Okay, anything else about ears? We're good.
I think that's the gist
Gracie
of it.
says, I'm so glad this is over because I wasn't liking this a whole lot.
What's the matter, Gracie? Huh?
We've got the tail going a little bit, so that's a good sign. Okay, that's done with the information on the ears and nothing else, and we will come back and do the next section. All right, we're back now with the third one of our presentations today on the eyes, ears, and on the teeth. And this time we have a special guest. Who is our special guest?
This is Charlie. He's my dog. He's a rescue from California when I was out there for school. And we're going to talk about dog's mouth with him.
Okay. Okay, Charlie, are you ready? He says, I'm not really ready for this, but I think I can handle it.
I brought him because as a little breed dog, he does have some mouth troubles. We tend to see more dental disease in the little guys than the bigger dogs. And so he's used to getting his teeth brushed in.
Do you brush their teeth?
Yeah, I'm going to show you how to do it.
I hear that all the time. Sue, you need to brush their teeth. I say, you know, I do a lot of things, but I don't brush dogs' teeth.
Yeah.
I'm just not
It's not
into
too
that.
bad. I'll show you.
Okay.
We'll get through it. So,
What?
like ears, dental disease is another, just very common thing that we see. And I think it's overlooked a lot because how often do you really look in your dog's mouth, If there's discharge coming out of the eyes or their ears smell, that's pretty obvious. But it's not often that, you lift up their lip and say, oh my goodness, look at that gingivitis.
Yes.
So, it's pretty common. Most of the patients that come in, aside from the puppies, have some degree of dental disease. So there's a lot of things that you can do at home before we have to intervene here to get them cleaned up, or just to slow the progression of dental disease in between cleanings.
So when should we start really being concerned about the teeth? Right
so
away?
Anytime we see gingivitis, we say we have to do a cleaning.
When should be my first time that I bring a dog in to have the teeth looked at? Or is that just part of the general?
It's just part of the general examination.
Okay,
so
even as a puppy?
Even as a puppy. And so you'll notice we'll come through and we'll lift up the lip and we'll say something about, oh, there's some tartar on his teeth, yada yada.
Is there any tartar on his teeth?
Sadly, yes. He's getting close to his next dental, so we might be able to get a close-up of him. So if you look on the front tooth here by my index finger, that one looks pretty good. It's all pretty much white. There's a little discoloration by the gum, but it's not too bad.
And he's never lost any teeth yet?
Oh, he has.
Oh, he has. There's a few in the back.
Do you see in the back there how there's that yellow-brown stuff kind of caked on his tooth?
Oh, yes, I do.
See that there? That's tartar.
Okay.
And then if you look at the gums by that, the gums are starting to get a little red, which is gingivitis.
Gingivitis, Charlie.
The progression of dental disease is first there's plaque, and that's kind of just like a clear film on the tooth that you really can't see. If we let that stay there, it hardens into tartar, which is what that stuff on his back tooth was. And if we let that go, eventually that tartar, which is basically a fortress of bacteria, it starts to creep underneath the gums and trigger an inflammatory response and things like that.
Okay.
And so if we let that go even further, the infection is going to spread to the roots of the teeth and the structures around it, and then we run into all sorts of trouble there. So the most common thing that we see is just some tartar and gingivitis. When we see that, we recommend a dental cleaning. That entails putting the dog under anesthesia.
For how long?
Typically, I would say like 30 minutes, as long as there's no major teeth extractions that need to be done. It's typically pretty quick, and it's very similar as like when we go to the vet.
Hold him for a minute. Go ahead. Sorry about that. Okay. Sorry about that, Charlie.
It's similar like when we go to the vet, so we go through and we crack all that tartar off. We get up underneath the gums with a little ultrasonic scaler just to get all that debris off and up underneath the gum line. And then from there we use a little polisher, just like they do at your dentist, and we go through and polish all the teeth.
I'm glad.
Now, if the teeth are really bad, if there's mobility in the tooth, if the tooth is fractured and the pulp is exposed, all sorts of reasons. Sometimes we have to pull the teeth. And Charlie has had quite a few teeth pulled.
Does he have very many left in there?
He has probably like 2/3 of his teeth left.
Good.
But if you look like in the front of his mouth, he's missing some teeth up there.
Yes, he is.
And when we found him, he had like a lot of debris kind of stuck up in there, and so the gums had started to recede back. And we kept it at bay for like a year, year and a half, but eventually they started, just to get some mobility, so we had to take those out. But like we talked about in our little cat seminar, if there's inflammation, there's pain involved with that. So if there's gingivitis, that's uncomfortable, and so rather than having him have all those inflamed teeth there, getting them out relieves that pain and that stimulus for the inflammation.
What about some habits that dogs can? I mean, I have a dog that eats bones all the time. Okay, no problem.
Well, we worry about like real bones.
No, some of those.
Like Nyla bones?
Yeah, Nyla bones.
Those are good. My one other dog, when she was with us, she loved those things, and her teeth were almost spotless. The nice thing about those is they'll oftentimes put them like in the corner of their mouth,
right,
and really work those back teeth, which are harder for people to brush and things like that.
The one that we had on the first part of today's show, which was Martin, he's 10 years of age, he's had one dental.
Yeah.
Because his teeth are just as good as they were probably whenever he was a pup. They were just wonderful shape.
Right. Now, real bones, can provide that same mechanical action, but we worry about them getting like shards of bone and cutting their mouth, or if they swallow it, cutting internal structures and things like that. So I don't usually recommend those just because of that risk. But the Nyla bones are a good alternative. I think rawhides do a decent job as long as you're there to monitor the dog, because if they get a large piece, they can swallow it whole, and that can cause some trouble. Charlie, unfortunately, does not like to chew on anything.
Yeah, some don't.
He makes me do all the work. So we'll go through some of the things that you can do at home that can slow the progression of dental disease. So there's a lot of different things. Brushing is by far the least expensive and the most effective. So I've got an example of a toothpaste that we sell here. The key thing whenever you're getting a dog toothpaste is first that it's a dog toothpaste, because some of the human...
I shouldn't use human
You should not use human toothpaste. Some of those have
important.
things that are not good for them. And then this is an enzymatic toothpaste. And that's very important. That means that it has an enzyme in it that's activated, by the saliva or something.
Good boy.
And that works to to get rid of that plaque. It's a little more aggressive, if you will, at getting some of that stuff that's building off. We know that aside from one product, which I'll talk about, we know that once that tartar is there, that thick brown stuff, the only way to get it off is with a dental cleaning. But we can slow the progression of gingivitis and periodontal disease with some of this other stuff.
I think a lot of the veterinary clinics are now putting in dental programs.
Yeah.
Where you have, I know you have one here, where if my dog comes down and has a dental, then you send me a little reminder that says come back and just have the dental check so it's not getting out of control.
And the dental, we call them a dental progress exam. That's, no charge. It's just to say, 6 months from the dental, oh boy, she's got gingivitis again already, we better do another cleaning. Or, a year out, oh, teeth look great still, keep doing what you're doing.
What about the bad breath associated with dogs? And that's the biggest complaint. My dog has the worst, that's what people say.
Yeah, and that's from the bacteria that's in that tartar and plaque.
And that's usually an indication we've got to have the teeth looked at, because there might be tartar there?
Some dogs will have bad breath without having significant disease. But if it's like really foul smelling, we can get like some abscesses or like more significant infection and things like that.
Can dogs have hard teeth and soft teeth? Are some dogs' teeth more prone to having to have dentals?
I think small dogs in general are more prone to dental disease. Puppies have softer teeth. They're a little more fragile and can break if they chew on rocks and things like that. We'll get there in a second.
Yeah, some dogs chew on rocks.
Yeah. Which is not advised.
Not good. Not good. Take the rocks out of the mouth.
So I'm going to show you how to brush a dog's teeth. So I don't know if you noticed, but he was already like trying to get the toothpaste.
Oh, he likes it.
Yeah, he's very excited about it, and that's because this is poultry flavored.
Oh, wow.
Yeah. So he gets very excited about it. They make a vanilla mint one as well. I try to stay away from that. I don't want to mix it up with my own. I think there might be a beef flavored one.
How often do we do this?
I do this, I try to do it at least like 5 days a week.
You are kidding me.
Yeah, but that's because I know his teeth are bad and I don't want to be doing a dental cleaning every year if I can avoid it. So you can think of it as you're saving yourself money, by doing this. You're minimizing the amount of times that he has to go under anesthesia. You're improving his quality of life because there's not inflammation there. I could give you all sorts of reasons.
I know, and you're doing that. Now you're making me begin to feel guilty.
So the first thing to do if your dog has never had his teeth brushed, is I just get a little bit, put it on my finger, and let him lick it off. He thinks it's a treat. It's chicken flavored. He doesn't know he's about to get his teeth brushed. Look how excited he is about that.
I mean, I think there's something wrong with Charlie that he's looking forward to this. But keep going.
Now he was on the streets of LA before, so I can promise you he never had his teeth brushed until
I'm sure
we got involved. So from there,
can you get it from there?
Yeah.
There you go.
From there, it's easiest to get the teeth in the front, and so I'll start with just one of the front teeth. So go a few days of letting him just lick it off, realize that this toothpaste stuff, this weird gel that's coming out of the tube, is a good thing. And then I'm going to switch sides because I'm right-handed. So then from there, the next step would be just to do some teeth that you can reach easily. Don't just start off reaching way in the back of the mouth. So start with the front ones. So all you have to do is lift up his lip like that, and there's the tooth, and there's gentle brushing. Okay?
I don't know that I see me doing this, but I'm gonna
and this is just
open-minded.
a children's toothbrush that I got at the dollar store. It doesn't need to be anything fancy, just soft bristled. And then once you do that for a few days, get them used to doing the teeth in the front. You can add a tooth at a time. You don't have to just jump right into it. Keep making it a positive experience. Then you can start to work up to some of the back teeth. And so we would start off. We would do our front ones, and then I would get here in the back.
God, I can't believe he's letting you do this. Is it this easy with most dogs?
I think most dogs tolerate it pretty well.
We don't have to use, we don't have to rinse it out or anything?
No. They don't have to rinse it out.
No mouthwash afterwards?
Right. And then, you come to the other side and do the same thing.
It's not taking you very long. Would it be a lot longer if you
It would be a lot longer. I mean, it typically takes me about like a minute to do it and do it right.
A minute per tooth or?
A minute total.
Oh, wow. That's not very long.
And you're mostly getting, like the top teeth where a lot of that tartar and stuff builds up.
Oh, more on the top teeth than the bottom. Someone just told me that's where
the food. I think I told you that.
Was that in the cat? Was that in our cat presentation? You talked about the majority of teeth that are better on the top.
Yeah.
See, I remember
now we have to pull teeth on the bottom too, but it seems like more of the debris kind of gets forced up into the top of the mouth. And I mean, he's crazy about this stuff.
He really is. Charlie, you're doing pretty good.
Okay. So that's brushing. It's not as bad as people make it out to be if you go through that stepwise process.
Okay.
Now, he's kind of skittish, right? So if I just came at him for the first time and just went to town,
I don't think that would work.
He would probably hate getting his teeth brushed for the rest of his life. But, let them know that it's a treat, it's a positive experience. Start slow, let them lick it off the brush or your finger. Start with the front teeth and then slowly work your way to the back.
Okay.
Okay. So from there are some oral sprays that we can use. This one is called Nolvident. It's kind of an alternative to brushing, and it has a nice minty smell. So versus their breath smelling like chicken or beef or something, they get this nice minty smell. And for this, I usually recommend a little gauze square. And what you would do is you would spray some of it on the square, and then your tooth is essentially going to be the brush. So you can smell that. It smells pretty nice.
Oh, that's not bad at all.
It smells like Listerine or something.
Yeah, it does.
And for
Will
this,
he let you do this?
I've never done it to him, but he's used to getting his teeth messed with. So I'm using my finger as the brush and scrubbing the tooth that way.
Okay.
And it's the same idea. It's got, instead of like an enzyme in it, it has like an antibacterial product in it, and that's working to get some of those bacteria off of there.
Okay.
Now, this is a little harder, at least for me, to get like way back in his mouth. But for a big dog, they've got a much larger mouth and you've got more room to work with. My finger is like half the size of his little mouth, so it's a little harder to get back in there. But in a larger mouth, you can certainly get all the way to the back.
And we can get this at most vet clinics, something like this, or online or something like that?
Something similar, yeah.
Okay.
We carry this all the time.
All right.
There's another spray that we carry called Liba 3, and I use that with him as well. And what that does is, it doesn't work for every dog. I'll start off by saying that. It's probably 50-50 as to whether or not it's going to work. I used it in my German Shepherd, and it worked wonderful. I use it on him, and I brush more regularly with him, so I don't know if
Did you brush the German Shepherd's teeth too?
I would do it once a month with his bath. I was kind of bad back then.
Okay.
But like with him, I have to do it multiple times a week. Otherwise, his mouth just progresses so quickly. But the Liba 3 is the one product that can actually get some of that tartar to come off of the teeth. It mixes with the saliva and kind of works to get some of that off of there. And so with that, it's a little pump thing as well. And you just kind of lift up their lip and spray it in there. It mixes with the saliva.
Okay.
You're good to go. It's 1 to 2 pumps depending on the size of the dog. But you know, it's something that's good to try. Some dogs that won't let you brush their teeth, it's something I recommend because at least we can try something. Other products that we have are some breath freshener. So this is another spray that you put in the mouth. It's also an enzyme-based product.
Would it help the tartar
like
at
the
all?
toothpaste, and it'll help prevent tartar buildup and get some of the plaque.
But it won't get it off
Right.
if it's already there. We've got to go back to having the dental.
Right.
Okay.
Right. And so, and then the big benefit there is that it's going to make their breath smell better.
You'll smell better.
There are water additives. So you put some in the water, and we always recommend having a bowl of regular water and a bowl of the water with the product in it, just in case for some reason they don't like the taste of this. They don't go all day without drinking.
Okay.
But this, again, has some antibacterial stuff in it. It's going to help reduce the bacterial load in their mouth and also, you know, freshen their breath. And it's something that you really don't have to do. You put this in the water and it's good to go. And then there's an oral gel, which is a similar application process to the Novident. You would, you know, put it on a little square, your finger, and you just kind of smear it over the teeth, essentially.
So if they're not a client here, of course, then they can get that probably at their vets, or if not, online.
Something similar
Or
they should
Petco
have.
or something like that.
Yeah,
Okay.
and right now, because it's dental month, February's Pet Dental Month, we actually got some sampler packs of this. I think it's under $10, and you get a smaller bottle of each of these, so you can try it out, see, you know, does my dog like it?
Right.
Does it freshen his breath? You know, whatever it may be. And so that's a kind of, I think, a good way to get into some oral health care at home is by, you know, trying something like that out.
I use those biscuits, TD?
Greenies?
Yeah, no.
Oh.
The TD prescription.
Oh, the TD treats, yeah.
Oh, I use those because I use those as treats when they come in. So I call them, and whenever they come in, they each get one of those, and they come in 2 different sizes. I buy the small ones because I've got small and large dogs. And it's real crunchy, and I think it helps with the tartar.
Yeah, and that
as a preventative, not as,
Right.
as removing it, but certainly to help.
Exactly, and that's another great thing. It's a Hills Science Diet prescription food. It's called TD, which stands for Tooth or Tartar Diet. I can't remember
Oh,
which.
it's great. I don't know that I'd ever do it for them all the time because it's not the cheapest.
It is a
thing for me to
prescription
buy.
diet,
Right.
so it's a little more expensive. But like you said, the kibbles are larger, so
Right.
it forces them to chew. Some people or some dogs get so hungry that they don't chew very well. Charlie would be one of those dogs. And so the pieces are larger, so it forces some dogs to chew. And then the way that they've designed the kibble is that the tooth actually kind of sinks into it, which allows it to scrape the sides of the teeth, versus the traditional kibble where as soon as the tooth touches it, it just crumbles.
Right,
so you
that's
don't
what
get
I've
that
used.
scraping action.
I've been very happy with it. It really has kept down on the buildup of tartar.
And like you said, you can certainly feed it as a regular diet, or we'll often recommend what you do
it as
is,
treats.
you know, kind of subtract the calories from their regular diet, but use it as treats, you know, like 6 to 8 pieces throughout the day, and that way they get, you know, like a little mini brushing, if you will, when they get their treat. There's other treats out there like the greenies. He loves the greenies.
Yeah, I don't use those. I use the other ones instead.
All of those treat type of things, you know, I can't really say how effective they are. The greenies actually have some studies behind them. Some of the other products do as well. But you know, he really likes them, and you know, it helps loosen the bacterial load in there a little bit. Whenever you're getting any of this like dental care stuff at the store,
He says he wants you to hold him.
Come here, Char. Whenever you're getting
maybe
any
he doesn't.
oral care stuff at the store, you always want to look for the little seal on the back. It's the VOHC seal. It's the Veterinary Oral Health Care like stamp of approval, and it's a group of like veterinary dentists that get together and basically study these products and make sure they're actually effective, so you're not, you know, just wasting money.
So a lot of times whenever they do have a loss of teeth, it's usually because the tartar and gingivitis has been built up so badly.
It's progressed.
So you need to get a handle on this as soon as you can.
Right. And the thing is, if you do this at-home stuff or keep up with the cleanings if needed, that basically, you know, can almost guarantee that the teeth can stay in the mouth, you know, longer versus having to pull them because things have progressed so far.
Okay. Anything else we need to add? He's good.
He's not too bad, huh?
He looks pretty good. So we were able to do today, and I hope everyone takes the time to be a responsible pet owner. You've got to take care of 3 areas in concern, or at least be aware of them. Number 1, the eyes. Number 2, the ears. Number 3, the teeth. Thanks very much. Appreciate your attention. And if you have any ideas as to what you would like to have as far as additional programs, let me know. And Dr. Consla, thank you. Appreciate working with you.
Likewise.